Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
according to FIGO classification. According to FIGO classification, FIGO guidelines, we will have to start the screening by 21 years of age, irrespective of sexual activity. The pap smear is done every third yearly, and from 30 years onwards, along with pap smear, human papilloma virus DNA is done. If pap smear has high specificity, whereas human papilloma virus DNA has high sensitivity. So both these tests are done together, which is called as co-test every 5 years. If the patient after 30 years of age, the female continues to test only with pap smear, then the screening should be done every 3 years. If the female continues to test with pap smear and HPV DNA, then screening can be done every 5 years. In HIV positive females, screening should be done annually. After human papilloma virus vaccination, continue the screening as usual. When to stop screening? Screening should be stopped at the age of 65 years of age when the previous smear in previous decade is normal. If any of the pap smear in the previous decade were abnormal, then you should stop the screening at 75 years of age. Hysterectomy is done for a benign cause. According to ACS 2020 guidelines, age to begin screening is 25 years. Then the method of screening is human papilloma virus or HPV DNA test is done every 5 years till 65 years of age.
thank you and thank you for watching.